Gerald? 200. All right. So it's the third week of class. So we are just rifling through the course. Congratulations to all you guys. Don't forget, this is what's due today. All right. This is the first critical thinking assignment. I sent out a video how to. There's also was a slide deck that explained to you how to do it. So you guys should be totally set up. Okay. And again, the video that I sent out is right down there. All right. The slide deck in terms of how to do it is I click right in there and I scroll down and there it is. There's your slide deck right there. If you click on that, up it pops and it shows you exactly what you need to do. Okay, so it's pretty straightforward stuff. All right, awesome. You guys are totally together. All right, cool. All right, so it was my son's birthday yesterday. All right, he's going to be a junior, sorry, at USC next year. He just got an apartment at Hoover House, right across the street from the Target. So, you know, it's pretty competitive out there, guys. If you don't have housing, I'd look into it real soon. Okay, we're going to go into the weekly assignment here. This first lecture is going to be a bit of biology slash psychology. We're going to look at mental health issues. This is a big deal, and it's perfect that this week, you know, we've gone over the diseases of aging that were the primary ones: cancer, diabetes, and associated vascular disease. And then we're getting into mental health disease. And do remember that Alzheimer's is considered type 3 diabetes because 80% of Alzheimer's patients have diabetes. Um, the numbers are becoming astronomical, and the amount of care and the cost of care for someone with Alzheimer's is enormous. And you know, if you have a parent, grandparent with Alzheimer's, you're staring down the barrel $60,000 to $80,000 a year for their care. All right, and so it's natural that we're going to talk a little bit in this week in the second lecture about caregiving because there's a lot being juggled right now, you know, and hopefully we'll do better in terms of caregiving. I'm pushing for multi-generational homes. Here it is right here. You know, we're all set up. My kids can live here, and we can combine our resources and do a lot better. All right, so let's get into mental health issues, which is a combination of a focus on depression, clinical depression, and also a focus on Alzheimer's disease, okay, in terms of mental health. Now, if I were you, again, the video is going to go right here. I would, at this moment in time, scroll down to the very end, and you know, we provide figures that are supportive of what you see here in the video. So you don't necessarily have to go back and look at the video. And these are the figures right here. Okay, we see onset of depression is highest in your age group. Severity of depression is higher out here, and like greater likelihood of suicide out here. Okay, and we see this right here. So this figure may come up in your quiz. Okay, we're looking at suicide rates by age. Okay, and we see that deaths per 100,000. This is called prevalence. That's how people look at it. You see, it's a much greater likelihood of suicide as people get older. Okay, and there's obviously a lot of factors. Appropriate depression, where you lose your friends, you lose your health, you lose your spouse. Okay, and there we go. Looking at now the prevalence of dementia. All right, so these again are all the figures that are supportive of what you need to do is going here to the quiz. And I would hit continue and putting up my quiz and who's the highest risk group for suicide. Well, I'm just going to go right over here and find that answer right in here. Okay, so this is pretty straightforward stuff right there. Then I would answer the second question that says this protein is pathological in terms of Alzheimer's disease. Okay, we're gonna have to dig in. I'll show you how you do that too. And then here's another one right here that that is about the proteins. You're gonna learn all about this. The cost of dementia right here. Check that out. Okay, I think I saw that right here. So that's in the video, like I said, right here. So it's in this video. Okay, but we also provide that information supportively right in here. Okay, so we see that the cost in 2021 is $355 billion. All right, so this is how you navigate the quiz. Okay, pretty straightforward stuff. So, all right, so let's get in here. We always provide the PDF file just in case the link's not working. Okay, I prefer the link. So let's look at psychological aspects of aging. Okay. Alrighty. What we're going to do is do an overview and look at the key issues that older Americans, older people all around the world have to deal with in terms of their mental health as they get older. Okay. So first of all, we can look at just some statistics. Okay, and, these are this kind of information that can come up easily in the quiz. Okay, so if you're over 55, okay, there's about a 20% chance that you're going to be suffering from some type of mental health concern. The most likely one might be clinical depression and anxiety, those two which go hand in hand. Okay, we see that when we look at nursing home residents, however, okay, that 2/3, 67%, exhibit mental health and behavioral problems. Okay, and those numbers are astronomical. And then we see that only 3% seek professional help. Why is that? Why is that? Okay, and we go through a whole list of why this is. First of all, society has really inadequate funding for mental health services. It is what it is, and we have to do better. Um, primary care doesn't integrate well into mental health. Even down here in South Orange County, we don't have very many psychiatrists and psychologists, so it's really difficult to seek help. Okay, um, that's a barrier to access. All right, and then there's this societal stigma, of course, that is going to reduce the likelihood that you're going to go out and find help. Okay, we all think we can tough it out. You deny you have problems, but you get realistically, these problems are real. And then, like I said, there's just a general lack of trained professionals that are out there, especially when it comes to issues specific to older Americans. Okay. All righty. So these are other things that influence this whole aspect of mental health problems. Okay. Um, social support and relaxation have been shown to influence immune function and cardiac function. So if you're clinically depressed, the stress causes immune suppression, where you get sick more often, and it causes atherosclerosis. It causes lots and lots of vascular disease, including heart failure. Okay, all righty. As I was showing you before, when we looked over here, we looked at um, you know, the likelihood of suicide. Okay, and we come back in here and we see depression and suicide. There's a mismatch. Obviously you're more likely to be diagnosed with depression as you go through puberty and you have this early formation of your frontal cortex that controls the way we think and perceive our kind of where we fit in the world. But then when it comes to things that really bring you down and make you feel hopeless, like lose your friends, lose your job, loss of income, loss of spouse, and you're a widow, those precipitate a greater likelihood of suicide. And it's always men have a greater likelihood compared to women. And this is what's all about here. All right. This then is just another view of what we're going to go into in terms of Alzheimer's disease, in terms of statistics. Combination of Alzheimer's and depression, we do see that substance abuse is a major issue for older Americans. And again, it's not often identified and by physicians. People don't seek help until it's too late. Okay. Chronic illness is a major contributor to both Alzheimer's and depression. So I talked about diabetes and Alzheimer's disease. And then this is really a call out that we need to get people to specialize in the mental health fields that also specialize in aging. Okay, awesome. All right, so then we go from here. I'm going to get out of there. We'll go back in here. And now the second part of what we're doing here, we're gonna get here and learn more about dementia and Alzheimer's disease. Okay, so what we asked you to do here, and this is shown right here. Okay, so this is where you're gonna hone in on this. This is an example of the imagery of what you're gonna see. Okay, so we just did this article. I wanted you to read it. Now we're gonna navigate this web page or the associated web page. Okay, so you do that by clicking right here. Okay. You take it down here, all right, we're going to look at the basics of Alzheimer's disease. You click on that right there, and then it's going to get you into. So we can look at the fact sheet, okay, which goes over statistics, okay. So here it is right here, okay, and signs of symptoms, okay, stages, all right. So you just kind of briefly go through this. Here's a great video to watch about the pathology that's going to help you answer those questions, okay. And then we can go back here. We can look at, what is Alzheimer's disease, okay? Again, it goes over a lot of the issues that I was talking about. We go backwards in my browser again, and then goes over symptoms, mild cognitive impairment, FAQs, okay? What we can do to prevent, exercise, diet, lower your stress, okay? And things like that. Okay. Alrighty. So that's what that's all about. Okay. And I can get you right back to that same page by clicking right here. All right. So there's just a couple different ways of getting around here. So there's the fact sheet page again. All right. So everything we were looking at. Awesome. So there's just different ways of getting around it. So go ahead and show some curiosity, and you'll be able to really learn a lot about Alzheimer's. This right here is a great video that goes over the molecular mechanisms that will help me in terms of understanding these types of questions right here. Okay. All right. Okay. And again, this is the facts and figures sheet that we got all these from. Okay. So yeah, the video that supports it, and then you have the facts and figures sheet. Blackboard likes to do this. You have to give it a second click, and then it takes you to the actual page. And there they are. Okay, so these are the video, and then here's all the facts and figures that we were using, and we post a couple of the more significant ones. All right, guys, very cool, huh? All right, let's go backwards in our browser here and get right back into where we were at. Okay, awesome. So that's the drill on that. Okay, and then we're going to come down here, okay, and we want you to kind of interpret this, okay. So again, the shock and awe of the annual cost of dealing with this, okay. It's amazing. Remember we talked about the gross domestic product. Here's a big chunk of money going towards this, okay. Because a majority of the pay is coming out of the government through Medicare. And so no matter how much money is being brought in, a lot of money has to go out. We do this through our Medicare tax situation, okay? All righty. This reminds you of, how significant the costs are, okay? And then there's the cost. So that's just the cost for the person that that is in the facility. So it'll drain their savings. Okay, the out-of-pocket expenses that are not covered by Medicare, and then there's the actual Medicare costs. Okay, and then we look at the cost to you. Okay, this is the profile of a caregiver. Okay, and how you see right here, it interferes with your work. So you have less productivity, potentially you have to take time off, less salary, okay? When we look at caregivers, oftentimes you're the sole person that's responsible, okay? The average age of dementia millennial caregivers, all right? So you have a parent or a grandparent, so it's the average 27. That's right around the corner for you, and you're going to have to be dealing with this. Okay, spending a lot of time working with healthcare, trying to get things worked out. Okay, you're actually doing nursing tasks, helping out. You can see how this begins to pile up. Okay, so that's why you got to have a plan. You got to have a plan. We can go on and on and on. Okay. We look at more women than men are caregivers, okay? And on average, 15% of you will be a caregiver at any one point in time, okay? Yeah, you can look at these statistics and they're kind of staggering. This is an amazing video that looks at the impact of Alzheimer's has on people that are caregivers, okay? And then down here, This shows you what it's like to see a patient with Alzheimer's disease and the caregiving that goes into place at a long-term care facility that specializes in Alzheimer's. And you can see how this would really require a lot of hands-on. Okay, from that, then we want you to get in there and talk about how to handle this, how to help you. What can the government do? What can society do? Private corporations, what can we do to help people with this? Because this is snowballing, guys. People are getting older. You learned about this in this class, and this is the real deal. Okay, so get in there, my friends, mix it up, have fun with this, and then I'm going to drill you again on caregiving. We're going to look a little bit further in it, but this is a real good primer on this whole issue of caregiving right here. Okay, all right, guys, peace, and we'll see you next time.